Gravy Health, your pregnancy support.
Hello dear, today we'll discuss an interesting topic, danger signs in pregnancy. We'll describe the danger signs you must watch out for and what you must do if you experience any of them. But first, let's start with a scenario that will give you a better understanding. Here is Mrs. Charles, a 10-week pregnant first-time mother who woke up this morning complaining to her husband of pain in her lower abdomen and back. In addition to that, she also noticed that she was bleeding through her vagina, and her husband immediately took her to the hospital as he suspected that this wasn't normal. Most women go through pregnancy with some uncomfortable symptoms, but no serious problems. Normal discomforts of pregnancy could include nausea and vomiting, especially in the first 3 months, heartburn, a need to urinate often, backache, breast tenderness and swelling, and also tiredness. All pregnant women, their partners and families should be aware of these signs of complication and emergencies and know when to seek care from a skilled attendant. The faster the intervention, the better it is for both mother and child. So here are some common signs to watch out for. Vaginal bleeding. Early in pregnancy, spotting can indicate an implantation bleed. However, any bleeding in pregnancy should be investigated. First trimester bleeds may indicate an ectopic pregnancy, that is, that the baby is growing somewhere else and not in the womb, or it may indicate a miscarriage. Later in your pregnancy, bleeding can be due to miscarriage or placenta problems. Infections may also cause bleeding. If you notice any bleeding, then you should be examined by your doctor. Persistent lower back pain. Most women will relate to having lower back pain at some stage during their pregnancy. When it becomes persistent, it is best to have your doctor examine you to exclude kidney or bladder infections. Preterm labor may also be present with a persistent lower back pain. Sudden release of water from the vagina. Rupture of membranes before your due date is referred to as premature rupture of membranes, and you should be examined by your doctor as this may indicate preterm labor and significantly increase the risk of getting an infection. Occasionally, urine may leak out from your bladder, and it may be confused with amniotic fluid leaking out. Your doctor will do a test to determine the origin of the fluid. Little or no fetal movement. It is a well-known fact that babies do sleep while in the uterus, but when your unborn baby suddenly starts to move less or does not move at all, it should be a reason for concern. It may indicate that your baby is in distress. According to experts, you should count how long it takes for your baby to do 10 kicks. This should be less than 12 hours. If you notice a dramatic decrease in the number of kicks, or it takes longer than 12 hours for your baby to perform 10 kicks, you should have your doctor examine you and your baby. You can use our resources on our website to enable you chart your baby's kicks. Visit www.gravyhealth.com/resources to download our fetal kick chart. Headache or blurred vision. This may indicate preeclampsia. Preeclampsia is diagnosed usually after 20 weeks of gestation. Your doctor will be on the lookout for high blood pressure and protein in your urine. Sudden weight gain with severe swelling of the feet, ankles, face or hands may be a red sign in this case. If left untreated, preeclampsia can lead to a more serious pregnancy complication called eclampsia, which usually presents with very elevated blood pressure and seizures, also known as convulsions. This is very dangerous for both you and your baby. Contractions before week 37. Contractions, either painful or painless, that occur more than 4 times an hour or is less than 15 minutes apart, may indicate preterm labor. You may be able to stop the contractions by drinking 2 or 3 glasses of water or juice and lying down with your feet put up. But if the symptoms do not go away in 1 hour, you should contact your doctor. Your doctor may give you medications to stop the contractions. Other danger signs include having a fever of over 38 degrees Celsius, falling on or hurting your abdomen. This should be checked out even if you do not feel hot or sore. Feeling sick or throwing up excessively, especially if you have abdominal pain and a fever. Itching all over, especially if your urine is dark colored and your stool pale. In conclusion, remember that if you're worried at any time during your pregnancy, you should talk to your midwife or specialist doctor. Let us be more aware for the sake of our babies and ourselves. Do you know the 9 danger signs? Write them down.
For more antenatal videos, tips, tools, and professional help, kindly visit our website at www.gravihealth.com or visit our social media handles on Instagram, Facebook, Twitter, and YouTube at GraviHealth. GraviHealth, your pregnancy support.